you were just diagnosed with cancer, this sort of wham moment, and your brain stops working, you can't really think, and you don't really start thinking again, in my opinion, until you start whatever treatment it is. You're trying to navigate all of the different opinions and advice, and then it sort of settles down and you begin to get into the groove of things. And so it would be nice if a cancer diagnosis came with a checklist. Right? So when a pilot's about to crash the plane, not on purpose, there's a checklist that they go through to try and not crash the plane. And so it would be really good if we in healthcare systems had such a thing. But, high on the lists are who's going to be my team, and do they have the diagnosis right, and are there any special tests that are out there? And there are resources for all of these things, but it's a very steep learning curve. I think our advocacy group partners do a real good job of kind of coaching people through. This is not a time for random Googling, in my opinion. You will get distracted and afraid, actually, if you use that as your initial, am I doing everything right? Your Uncle Saul is probably not the right guy either, unless your Uncle Saul runs a cancer center somewhere. But, because just because they've had an experience with cancer doesn't mean it's the same checklist for you. But this is where I think the village comes into play, the experience, cancer's a common disease, and reaching out to folks who've been through it before can often be a good coach. And in particular, those first groups of doctors that you meet with and their teams, the simple question of, am I thinking about everything I need to be doing? Do I have everything I need? Is there anything that I'm missing? Most of us are pretty good at answering back on that.
I think that's such a great question, because a lot of times people will come in with a list of their questions, but I think one of the best questions is there anything that I didn't ask that's important? And that there's no right or wrong way to go through a cancer diagnosis, and sometimes you just have to take it slow, and feelings are going to come up and situations are going to come up that you can anticipate and sometimes you can't anticipate. But I think it's constantly checking in with people who are there to support you, your medical team, and having a plan, like you said. I think it really helps feel more in control. And that's something we didn't really talk much about, of just how much cancer leaves us feeling so out of control. And it's finding ways to create some kind of control so that you can feel less overwhelmed.
When somebody gets a new cancer diagnosis, they deal with it in different ways too. There are the studiers. So they'll immediately go to the internet or books or journals, and they know enough about the language to read on it and understand, and they want to know everything they can know about their diagnosis. There are others that are sort of the ostriches who sort of say, I'll just put my head in the sand and I'll do what you tell me, but I don't want to go in and dig on all of that, because as I look at it, it makes me afraid or it makes me anxious. The first person is doing that on some level to get a sense of control. The other person doesn't want that sense of control, wants us, the white coats, to have the sense of control, have the control, and they'll do what we say. But that feeling of falling, lack of control from the diagnosis, different people handle it differently.
Absolutely. We all cope differently, and cancer doesn't happen in a vacuum either. We have other life stressors, so depending on how stressed somebody is in other parts of their life is probably going to be an indicator of how they're coping. But I also think, too, it's just not putting the pressure on yourself to do it perfectly, or there's not one right or wrong way to do it. It's what's comfortable for you in that moment.